Before Bihar, I'd like maybe to just think and talk a bit about India as a whole and how you guys are feeling about it. If you step back a bit from your everyday lives, you'll acknowledge that you're feeling very mixed about it. In a room like this, there's so much energy, optimism, dynamism, possibility, achievement already. And we can't seem to trust our government so far as we can throw it. If you read any newspaper, it would appear that they cannot manage this economy. It would seem unable to provide the enabling environment that would allow further flourishing and further possibility. A bit harsh? How do we bring this kind of innovation, this kind of value creation, this problem-solving ability that we're seeing in this room to processes of government? I mean, it's a really wicked, difficult question, which honestly I never thought that I would even be trying to solve. But circumstances have conspired in this way. So what we're trying to do is to bring that kind of startup entrepreneurial zeal, the ability to think in terms of design and innovation to public systems, making this a normal way for governments to behave and public systems to act. That's the larger vision of the Bihar Innovation Lab. Now, more on that in a second, but first maybe I'll just talk a little bit about what I mean by innovation. For the last decade, I've run an innovation consulting company, and this little diagram kind of encapsulates our approach to innovation. You try to understand what people need, what kinds of challenges they face in their everyday life, try to organize that information into a series of needs, opportunities, try to conceptualize ways to solve those problems, create a series of prototypes, test which ones of them are going to work, go back, eliminate pain points, and take things to market. And that's the kind of advice and support that we've given our clients over the last decade. People in the telecom space, Nokia and Vodafone, lots of operators, GE Healthcare, some Indian companies as well. So this broad approach that we've been developing on our own early on, I must say, working more with multinational clients than with Indian clients, but more recently with some startups as well. We were interested to see if this could be brought, first of all, to the social sector. And we were approached at a certain point, about 4 years ago, by the Gates Foundation. They asked us, can we go with them to Bihar and try to figure out how to change the public health system there in a radical way? So this is the kind of work that we did. Social scientists working with designers, boy-girl teams, 5 different talukas, working for 9 weeks at a time, observing how people interact with each other, trying to figure out where the failures are in the delivery process, where the disconnections are between the informatics, the data, the biomedical elements of the service, vaccine delivery, contraception. Where were the cases in which consumers were being, turned away or failing to appreciate what the service providers were trying to offer them? So the kind of data collection, that we did had to do with not only observing qualitative information, but, as we're saying, seeing like a designer, seeing opportunities in the field and organizing that information through field diaries and notebooks in qualitative ways, but also in a more structured way. I'd like to introduce to you something we call failure case analysis, which in my view is central to the design of systems. You cannot design complete systems if you don't understand where failure is occurring. So from qualitative or design research of the kind that I was showing you, we created a large number of failure cases, situations where rules, tools, or players were breaking down. We put this kind of data into very long, detailed spreadsheets where we explain particular instances where the service was not being provided because of some sort of failure. It could be informational, data, equipment, capacity, process, transaction of some kind. All of that kind of information, detailed, rich knowledge of failure became then the basis for how we concepted an array of possible solutions. So this thick description of failure I offer is extremely important to the transformation of our public systems. Extremely important to addressing the grand challenges of our society and of many other societies, the challenges that have proved intractable so far. Those grand challenges seem, insuperable when they're described, in a single sentence, like the people are poor, right? People are hungry. Only 45% of kids in India get vaccinated. But when we break down those huge challenges into granular descriptions like this, solutions begin to emerge. So our next step is actually to build this thing out institutionally, and we're hitting the ground in about 6 weeks in Patna and in Delhi to go out and address the top 4 challenges that have come out of this kind of detailed analytic. So what we're doing is something around a kind of iTaviz, a series of health tokens that help frontline workers figure out what different kids have, what patient histories are, use handheld devices to track individual patients, something around improved session site logistics, a new kind of biomedical carry case workstation, a kind of vaccine delivery kit, and then a kind of digital partograph. Non-digital paragraphs are already known. This would be an intelligent, interactive kind of paragraph that helps you track labor and ensure that women that are hemorrhaging or going south in terms of their delivery can be rapidly institutionalized. Now, these are not rocket science solutions, frankly. Hard to imagine wrapping a company around any one of these problems, at least for me. But the next step going forward is to begin addressing challenges that we are not adequate to. That is my team of public health expert, product designer, some design engineer, a couple of social scientists and ethnographers, market researchers, will not be able to address complex problems around tuberculosis discovery, as well as then patient referral, etc. Those kinds of challenges are going to require competencies that well exceed even those within the room. We're going to need to find ways to put together very specialized competencies of a kind that did not board together, did not all go to the IIT Bombay together. So biomedical as well as different kinds of IT competencies are going to have to come together in some new ways. Chemical scientists are going to have to come together in a new way to solve particular problems. So what we see as the future of the Bihar Innovation Lab is a kind of matching point, matching center, if you will.
1 minute left.
Highly defined challenges and particular kinds of expertise brought in through fellowship or brought in through other mechanisms to assemble or engineer new teams that can solve those challenges. So that's my invitation to you guys. If you guys are interested in figuring out how to develop this model further, I often joke about it as being a kind of inseminator, right? It's not an accelerator, it's not an incubator, but it's actually a way of matching young talent to the hardest challenges that we have in our society in a structured way based on a detailed analysis of the actual challenges on the ground. So I think we can really benefit from some of the expertise in this room, and if you'd like to chat further, I really would welcome it over the next day or so. It's a test bed. It's 101 million people where actually a lot of coordinated activities are going on, thanks a lot to, yes, Bill and Melinda Gates Foundation. There are, I think, some incredible opportunities, and there's a willingness on the part of that state government to try stuff out. And there's an urgency to do things that I've not experienced before. I'll bet probably there are some other states where we see that same kind of willingness. So the opportunity to actually change government, to make this public innovation possible is I think, tremendous opportunity and absolute need. Because if we don't find a way to do that, kind of drag on our economy is something that we really can't afford. Thanks much.